Okay. All right, Katie, you can go to the next slide. Upcoming sessions. So next Tuesday, we actually quickly put together the super fun talk. Even Kurt was impressed. I have a video of him telling me how impressed he was with me. So we might have to play that. Don't hear that very often. It's kind of like all the little things that come up when you're doing Suboxone buprenorphine in your clinical practice, like the questions that you find real time that you would never think to even know or ask ahead of time. So you can see kind of the rest of what's coming up on that. And then next week on this echo, sex trafficking victims and how that all plays in. And then the week after, pain and CBT, I said that again, CBT-based management.
That's by Murray?
All right. So.
Next slide. We don't know. Remember, if you need some technical assistance, just take a snapshot of that. You can call Aaron, you can call us. Our phone numbers are there if you have a patient question.
Had a super interesting case yesterday. I can't wait till they can present it. And then the online site. So anything and everything y'all might want to know about getting onto any of our echoes. We are gradually working on updating all the paperwork and forms. So if you want any of the forms that we've used or the policies, they will all be there. Lots of information. There you go. For submitting cases, though, for all of these echoes, Katie, you can go to the next slide. This is kind of how you'll do it. It's on the site. If you click on you want to attend an echo, find the correct echo for the Wednesdays. This is not. Click on more. The case will be right there. You can fill it out. We actually made that case presentation form way more simple.
Yep.
Way more simple.
One page.
One page.
Remember the Addiction Connection podcast, we just had one come out yesterday, and I believe it was about some interesting off-label drugs for alcohol.
I've had people text me asking me, is that one that people use everything for? Is it gabapentin? I'm like, no, it's even better than that. So
yeah, can't talk about it. You got to listen.
The last one is very awesome.
All right. Today's talk, again, we have Ryan with us, Ryan Carroll. And
he's from NIDA. Well, no, HIDA, excuse me, which is part of the Office of the ONDCP, the Office of National Drug Control Policy. He is a drug intelligence officer. I think that's correct. Ryan, I'll let you introduce your actual self.
Sounds scary.
Sure. Yes, thank you for having me. She's correct. I work for the North Central HIDA, which stands for High Intensity Drug Trafficking Areas. So it's a program out of the Office of National Drug Control Policy, and is now in all 50 states. I'm part of an overdose response strategy team. My colleague is Haley McCarran, who I'm sure some of you are pretty familiar with. She's the public health analyst attached to the overdose response strategy. So the two of us work together in Minnesota, and I'll get into it here in just a little bit, to help with the opioid response and the opioid epidemic, specifically in Minnesota, but with the ability to reach out to our other colleagues across the federal system and in all 50 states.
As you share your slides and you get going, we will keep track of the questions that come up. So you don't need to watch the chat. We'll kind of do those at the end.
Great. And if you're ready, are you ready for me to get going now then?
Absolutely.
Okay, very good. Now I will share my screen, and sometimes this gets a little off with multiple monitors, but I'll do my best here. All right. How is that? Is everybody able to see that?
Yeah, it's not the presentation, the slideshow version, but we can see, the line, the things on the left and underneath.
Gotcha. So we're ready then.
Perfect.
Okay. A little bit better. All right. So the update for this particular course, obviously, as we said, is for the local national drug trends, which are in particular helping to drive the opioid epidemic and the overdose epidemic that's happening not only nationwide, but also here in Minnesota. As we said, I'm the drug intelligence officer assigned to the North Central HIDA. I retired from law enforcement after about 23 years. Started this position back in December. So I started working here with Haley. So what is HIDA? Again, it's a high intensity drug trafficking area. It requires a federal designation. It goes by county, and currently Minnesota has 7 counties which are designated as HIDA. That does not mean we cannot provide assistance or resources to other counties in Minnesota. It just means there are specific counties which have been designated as having a higher than normal intensity of drug trafficking going on. We are assigned to the Minnesota Investigative Support Center, which is supported by the Hennepin County Sheriff's Office. And the 7 counties that are now included in HIDA are listed there. And I know Stearns has put in an application again. That's the only one I think in Minnesota that I'm aware of this year. But they did put in for that HIDA designation, and I haven't heard of the outcome of that yet, but that is in the works for Stearns County anyway. So what is the overdose response strategy? Simply collaboration between public safety, public health. There's been a lot of barriers identified from law enforcement, public safety, as far as they're trying to get information to help and they're maybe impeded by HIPAA or just other things where it's hard for law enforcement to kind of ingrain themselves with the public health community, and vice versa. For public health, they've had, the standard response, on the public health side, might be HIPAA. On the law enforcement side, it might be, well, that's law enforcement sensitive. Well, it's getting nobody as far as they should be going because there's these roadblocks in between. So the program is created exactly for that. And again, collaborate across public health, public safety, and then to share those data, insights, and trends. A lot of that, there's a lot of public health data out there. There's a lot of law enforcement data out there. Combining those two is really a force multiplier for helping to decide whether to fund the project or not, and really to find out what public health is doing, what public safety is doing, so that not everybody's going their own way or, inventing a program that already exists. So that's what we do. And then also inform and help local communities. There's many resources available, which I'm sure you're probably familiar with some, if not a lot of them. And again, that's outside of the designated HIDA counties as well. So national trends, the biggest one is the illicit fentanyl. And you'll see referred to later in here as fentanyl-related substances, which means there are, last count when I was through a presentation by the Customs and Border Protection Laboratory, 4 dozen analogs that have been identified in the United States of fentanyl. So parafluorofentanyl is one, and just on down the list. And it seems like every time the DEA lists one as an actual controlled substance, they come up with another one that is not listed in the Controlled Substances Act. And, there are some decent chemists out there who are actually producing this stuff or coming up with the ideas anyway. And I say decent as a relative term. It means they're not idiots. They are producing a product that's killing people, but they do have some knowledge in this area. So, and 2 examples, it's entering the United States in both powder and pill form. If it enters in powder form, kilogram variety, it can go to areas where, it's pressed, therefore, into pills and distributed nationally and then onto the local streets. 2 big seizures recently are, 254 pounds of fentanyl powder. That was seized out of a semi carrying a load of cucumbers at the Mexico-U.S. border. A huge amount of fentanyl powder, if you think about after that, it's broken down into dosage units. So when we speak of dosage units, we'll talk about that a little bit later as well. It can be, it's a little bit of a relative term because a dosage unit for one person might not be the same as the next. Well, roughly a kilogram of fentanyl provides about over 600,000 dosage units of fentanyl, meaning if they were smart and they knew how to mix pills and there was 1 dosage unit per pill, that's about how many pills that a kilogram of fentanyl powder would produce. And so it because of the potency of it, it really doesn't take much to spread that out. And on the right picture there, that was out of Scottsdale, Arizona. It was a cooperative case. The Sinaloa cartel out of Mexico has a big presence, obviously in Mexico, but also the United States. And this was one where there were about 1.7 million fentanyl pills seized. So on the left side is the powder form that's coming in, the right side's the pill form, and it comes in many varieties of those colors and such. But on the right side there, that's about $9 million worth, roughly, of street value if had that hit the streets. And these are national seizures, and as they're reported to the El Paso Intelligence Center. It's a nationwide intelligence gathering operation in New Mexico, and the national seizure system is one that local, state, and federal agencies report seizures into. So as you can see here, lots of fentanyl in 2021, and it's continuing in 2022. Of note is the largest seizure of fentanyl so far this year, and I think it's the record as far as all time as well, was 4,499 pounds of fentanyl, which is absolutely incredible when, again, you look at the calculation from pounds or kilograms to dosage units. And so they're absolutely flooding the market with this right now. And the record quantities of fentanyl the DEA seized in 2021 are enough to kill every American. Literally. And if for some of you who were at the RX Summit, this slide was directly from the DEA's presentation. And we're using that here because when I saw this during that presentation, I guess I was shocked. I didn't realize quite the scope, because sometimes we look at stuff on paper, local or national trends, and it really doesn't translate into something like this. So in the facts and again, in dosage units, so in 2020, it was about 2.9 billion doses seized by all HIDAs across the country. 2021, it more than doubled. So, and again, there's the dosage units for every U.S. citizen. So if everything was seized, you could dole that out to every citizen in the U.S. and everybody would get 20 dosage units. Absolutely staggering as far as how much is coming into the country. The counterfeit pills. These are extremely dangerous because on the street, as we'll see later, it's very hard to tell the difference between an actual pill and a counterfeit one. They're actually pretty decent with these pill presses, but the OxyContin is probably the biggest one we see here in Minnesota, but it's also as well as what's the most prevalent nationwide. Adderall in the center there, and then the Xanax on the right. Those are also seen here in Minnesota. In particular, a recent seizure by the Minnesota State Patrol had a load of Adderall coming from the West Coast, out of the Seattle area, that was destined for here, which, again, we don't see as much of that as the counterfeit M30s listed on or shown on the left side there, but they are here and increasing just a little bit this year. Again, with the trends, the reason I put methamphetamine and cocaine in here is because not only are the amounts increasing, but the amounts that are combined with fentanyl are also increasing. Not only nationwide, but as we get into it, we'll see Minnesota as well. We're following that trend, unfortunately. Purity and potency remain high for the methamphetamine side. Prices are low. They absolutely flooded, when I say they, the cartels in Mexico absolutely flooded our U.S. market with methamphetamine. The price dropped. The number or the amount that was coming in at each time skyrocketed. I remember when I was working highway interdiction, a seizure of 10 pounds of methamphetamine was incredible at that point in time. Now we're seeing it in the thousands of pounds and hundreds of pounds, particularly here in Minnesota. So absolutely flooding the market with this. And you can see the numbers seized there. 2021 was 386,000 pounds that was seized. Now, when I look at the seizure numbers, obviously seizures, we're not getting everything. In fact, it's a small percentage of what we actually get. So if you look at it in those terms, how much is actually passing through is absolutely incredible. Same with cocaine. Again, it's readily available. There's a lot out there in the market. Minnesota, it's particularly prevalent around the metropolitan area. As you get out of state, not quite as much. But again, the concerns are there with the combination with fentanyl. We're seeing a lot of overdoses in individuals who swear they only took cocaine. They've been a cocaine user for years, and now they're experiencing an overdose. So lab results come back. Sure enough, it's contaminated with the fentanyl. So this slide and the next one are particularly interesting, not only because of the amount of seizures coming in and what they are, but when it's broken down into the dosage units. So as you see here, the yellow on the left side indicates percentage of seizures by all HIDAs. And it's 47%, and then cocaine's about 49%. So that's the total amount by kilogram that's being seized in the US by these HIDAs. And if you look at fentanyl down there, it's only 2%. So you think, well, it's only 2%, it's not as much coming in. But again, because of the strength of that, the next slide here, excuse me, shows, so this is a number of dosage units. So when the seizures in that previous slide are broken down into dosage units, you can see that 65% of the seized drugs coming into the United States by dosage unit are fentanyl or fentanyl-related substances. So when you look at those two back to back, it's again, it's because of the strength of the fentanyl and fentanyl-related substances coming in that these dosage units are so high. This chart here just shows a progression over the last 10 years of fentanyl seizures through all U.S. HIDAs. And if y'all remember what happened, around 15, 16, obviously some of the pharmaceuticals, it started to decrease, right? So we got some rules in place, pharmaceutical diversion and others with prescriptions started to go down. Well, what started to go up? Cartels and others noticed that there was a gap in the market for those. And obviously there was a need here in the United States for those. And this is why in that period of time, these started to go up at a staggering rate. Up over, as we discussed, 6 billion dosage units in 2021. Cocaine seizures followed a similar line for different reasons. There's always been a market for cocaine in the United States, but it has increased, as you can see, correspondingly around that same amount of time. Again, a lot of it is now contaminated with fentanyl, so it's partially driving this increase. Methamphetamine as well. There's, again, when we talked about flooding the market, you can see again what happened. This started a little bit later in about 2018, but the number of dosage units for methamphetamine has gone up at a staggering rate as well. And this slide, I'm sorry, I'm going to back up here one. So as I start these next slides, what it's going to show, and it's going to go through a transition at about a 2-second interval. And what I want you to do is take a look at the map and watch how it transitions. It's showing the overdose rate per 100,000 population across the United States. And I can play this once or twice, but what it shows is that we here in Minnesota typically follow trends that start on the coast, east, west. It sort of squeezes in, and then we in the Midwest, north central Midwest, then get mixed into that. So as you can see over these next slides, you'll see how the overdose rate over the last 5 or 6 years has really impacted the entire country. So as you watch this, it'll transition through it. And as it goes from white to light gray to dark gray to red, now we're in 2020 and then ends up in 2021. So as we explain, this tracks right along with some of the trends, the opioid epidemic, as you can see, it initiated, so to speak, out on the East Coast, and then it spread. Now it's a West Coast, East Coast, and it's moving into the Midwest as we go. And I can play that one more time to just take a look how Minnesota and the surrounding states transition through here. So this is the most current data that's available here. And this is courtesy of the National Emerging Threats Initiative, which is part of the HIDA program. So now we can transition a little bit to Minnesota. And when I say North Central HIDA trends, North Central HIDA comprises Wisconsin and Minnesota. And many times what we see is, we're put together in this particular HIDA region because we are very similar. We share similar trends, trafficking, In fact, there's a lot of traffic back and forth between Wisconsin and Minnesota. So the North Central Haida, when I talk about that, it is the Minnesota-Wisconsin team. So the major threats for us here in Minnesota, again, fentanyl and fentanyl-related substances, the methamphetamine, cocaine, especially because of not only the drugs themselves are dangerous, but because of the contamination with fentanyl. And cannabis, and that's supposed to be THC. I must have missed that one. So that's THC products, which normally surprise some people. But the reason those are on there is because it is a very big industry. There's a lot of money involved there. And there is a lot of crime associated with marijuana, THC products. The other part of that issue is we're also seeing overdoses related to these THC products. If anybody's ever been to a presentation, I remember one that it was called Not Your Father's Weed. And, talking about the differences in cannabis from the 60s, 70s up to today. The potency's up at least quadruple from where it was, or the THC content. And then the edibles are another issue where, they're highly concentrated and users end up overdosing literally on the THC because they may take, for example, 5 gummies instead of the 1, which is a serving. And the effects are a little bit delayed. So they may take another one or another one. And when they all hit, they end up with an emergency department visit because they have no idea what's happening to them, because they only took THC or they only had marijuana. So we're seeing that in Minnesota as well. The interesting thing, which is a good thing, is heroin seizures are down in the North Central Haida area in Minnesota about 44%. The problem is it's been replaced with fentanyl and fentanyl-related seizures. Why is that? Well, as we talked about, fentanyl and related compounds are extremely potent. And so a kilogram of fentanyl can be purchased for somewhere around $3,000 to $4,000. But by the time that's broken down into dosage units and sold on street level, it can produce as much as $1.2 to $1.3 million from that original $3,000 to $4,000 kilogram. So you can kind of see why some of these cartels are changing gears a little bit. Also, fentanyl is easier to produce. The chemicals are often brought in from China's the biggest one. It's cheaper to produce. It's easier to produce. It requires less effort on the end of the producers and the cartels down in South and Central America. These two show, the graph on the left is showing the amount of fentanyl seizures in kilograms, and that's not thousands. That's a very small decimal point in there. So it's about 60 kilograms of fentanyl that was seized in the North Central Haida region. Again, if you do your dosage rate conversion, that's literally millions of dosage units that were seized. On the right side shows dosage units seized. So these are separated because on the graph on the right, it shows the dosage units. If a officer seizes pills on the side of the road, those are typically not weighed and then listed as a kilogram seizure. They're listed as dosage units. So if they seize 5,000 pills, that's what's included on the screen on the right there. And so these are actual seizures that happen throughout the Haida initiatives in the North Central region. Of particular interest on that one, if you look at the graph on the left where it's just kilogram seizures of fentanyl, you can see in 2020, a little over 7 kilograms were seized, but in 2021, there were over 60. And granted, that could be several large loads, but what that tells us from the law enforcement perspective is, again, when we talk about flooding the market nationally, that's what we saw, or that's what we are seeing here in Minnesota, is you're seeing these larger quantities of drugs shipped here in an effort to flood the market with these substances. Of note is xylazine, and for this particular audience, I think it's especially important. This is again a national trend which is squeezing into Minnesota. So it's a veterinary drug used as a sedative, and they'll throw just about anything in with these drugs, but as if fentanyl was not dangerous enough, now it's being mixed with xylazine. Xylazine will not respond to naloxone much as some of the other opioid or as the other opioids. So that's a particular problem for not only responders but other medical personnel as well. So xylazine was the first one they saw for Department of Health statistics anyway. The first one that was found in Minnesota was 2019. Since then, through mid-year 21, there have been 23. All of those had fentanyl on board as well, which again falls in line with the national trend pushing here to Minnesota. The counties of death are listed there below if you'd like to take a look at those. But the important thing here is it's been increasing nationwide for years, as it has been here on a little bit lower scale thus far. But it is something we are tracking very closely because it has gone up substantially since it was found in 2019. So for Minnesota trafficking patterns, normally the pills are pressed prior to entering our region. They're either pressed in Mexico by the cartels prior to coming up here, but it may also be easier to smuggle, as we saw the powdered fentanyl seizures coming into the country. Maybe easier to ship those kilograms to, say, Phoenix, Arizona, where there's a large pill press operation there, and then distribute pills from there. We have also seen, and I'll show a slide here shortly of pill presses operated here in Minnesota, in the metropolitan area. So fentanyl is moving here in its powdered form, and it's being pressed into those pills from here. So again, because of that profit margin that's available there, I think this is why we're seeing some of this. It's being shipped here. China is still one of the main producers of the precursors that are required to make fentanyl. Now, some of the bans and restrictions put on China a few years ago restricted some of this, but all that did was lead China to partner with the cartels in Mexico. So now a lot of the precursor chemicals are being shipped to Mexico, and then it's coming across either the southern border or being shipped from Mexico. And trafficking patterns. So once it enters the United States, it's typically shipped to hubs or distribution centers. Minneapolis or in St. Paul are a regional methamphetamine distribution center. As you'll see in a little bit, there's a 300-pound meth seizure here in Minnesota that was made last year. And the intention of that obviously is to be here, and then it's going to be redistributed across Minnesota to smaller distribution hubs, St. Cloud, Duluth, Rochester, for example, where they may ship 10 or 15, 20 pounds to those cities to then be broken down into user amounts. So opioids typically are routed through Chicago. They come up here a lot. There's also, not only in the Minneapolis area, but Duluth is a big one for a connection to Chicago. And most of the stuff that comes to the metro, that's where you're going to start seeing it, usually going up to the St. Cloud area. Interstate highway system is still the biggest. Personal rental commercial vehicles, of course, but they're also using postal service and express consignment services. So speedy delivery, UPS, FedEx, you name it, they're getting these products delivered to them through these companies. Use of the dark web is really prevalent too. In fact, kids are ordering drugs off Snapchat, Instagram, through the drug dealers there. So we've noticed large increases in Customs and Border Protection seizures where they're foreign shipments coming into the United States, as well as Postal Service seizures, sometimes even across town. They may mail it from one address on the northeast side of St. Cloud to the southwest part. Why? Because it's easier. You may not have a traffic stop in between there, but those seizures are happening across the state. Airport interdictions as well. Recent one at Minneapolis-St. Paul resulted in 28,000 counterfeit pills. And again, the content of those pills, they're statistically they're counted as dosage units, but As we all know with those pills, there could be 1 dosage unit per pill, there could be half, there could be 7 dosage units per pill, which is what results in a lot of these overdoses, is the inconsistency of the drug that's actually in there. And if you take a look at these two, I certainly couldn't tell the difference. And the problem is people on the street can't tell the difference either. They want to buy Oxy, or then there's many street names for it. That's what they want to buy. If somebody hands them a handful of the pills on the bottom there, they're going to look at those and think they got exactly what they ordered. They're not. But one disturbing trend we're seeing here in Minnesota as well is that people are actually seeking out fentanyl. So they may come up and ask, do you have any, and there's tons of street names again for it, but they're literally specifically asking for fentanyl from these dealers, versus before where the counterfeit pills were alarming because it was surprising people of the fentanyl content. Now people are actually seeking those out, and they will pass on pills that they don't think have fentanyl in it. Same with the Xanax pills, another very common one. And if I were to look at these two on the street, I wouldn't be able to tell the difference. So just demonstrating the problem with these pills for unsuspecting users. And on the left side there, that's a manual pill press for a low scale operation, obviously. But what they'll do with that is they'll get a kilogram of fentanyl, they'll get some binders together, they'll throw in whatever they have around the house to fill this pill up, because they use so little fentanyl per pill. And then they'll press these pills together. The pills in the center there are your ecstasy, MDMA, still prevalent in Minnesota, just not causing the amount of issues we're seeing. But there are also counterfeit ecstasy pills out there as well. The picture on the top right there with all the multicolored pills in the bags is just showing that they're not all M30s. These are all pills that have been seized that are counterfeit and contain fentanyl. So if they can dream it up or find the accurate dye for the pill press, they'll make pills and sell them as is. And the picture on the bottom just shows another example of counterfeit pills that contain fentanyl that were illicitly manufactured. The methamphetamine, as we discussed, not only the country is seeing a vast influx of this, but we are seeing that here in the North Central Hyder region as well. And again, the jump from 2020 to 2021 is substantial, and we're seeing similar seizures here in 2022. Cocaine, again, this one really stood out because of the cocaine in Minnesota available and seized in Minnesota has remained relatively constant until, as you see, 2020 to 2021. There's many things that could have led to this. With COVID-19 and the release of the restrictions, things like that has generated some additional seizures that we hadn't seen before. But really, it's, again, as we're following the nationwide trend of they're flooding the market with these drugs that are contaminated with these fentanyl-related substances. This, just to touch briefly on this was a recent case of pills headed here to Minnesota. The task force worked this. 75,000 pills were seized, along with just under $100,000 of cash, along with multiple firearms. So these are moving into Minnesota to redistribution points. This I won't cover in its totality. It's just showing some things we're doing, or law enforcement is doing, to counter some of this. Overdoses, when those happen, a lot of times agencies will seize cellular phones because we're trying to track down the source of these drugs. And this just briefly goes over what analysts will do to help figure this out. It started out with an overdose death in 2021 with Rogers PD. And this was the case that I spoke about a little bit ago, that it was in 2020, and it was, 380 pounds of meth, along with 4 firearms, which create their own issues. But the overarching problem here is that we are just being inundated with these different drugs, and it is driving the overdose problem, not only because of, say, the purity of this methamphetamine, but the contamination with the fentanyl along with it. So that was really fast. I know I wanted to try and cover as much as I could, but at this point, I can take any questions, and I can stop sharing my screen unless somebody'd like to see a different specific slide again.
Yeah, if you want to stop sharing the screen, at least for now, and we'll let everybody, so everybody can see everybody again. There's about 1 million questions,
yeah.
So fire away.
I guess I'm going to start with one of the ones towards the end that I thought about. So like when you were talking about the seizures and the task forces, one is, how do you get alerted to this? And then from the time that there's like this hint that this is happening or that it's coming in, how much time does that task force have to seize all of that? You see it on TV, it's very different, of course.
Right. Yeah, it happens in 30 minutes, but without commercials, it's 26, right?
Right.
No, so for us, it really depends, because if we have a notification from, say, Customs and Border Protection, so that means shipment is coming in from outside of the country. Several days in advance, the shipper will have to alert them, or they have to do the paperwork to ship these substances, so they can give us a heads up. If Jimmy Johnson has a package expected in 3 days, then we have 3 days to maybe put something together where we can work this. Other times, we've had one recently that was 5 pounds of methamphetamine going up to the St. Cloud area, where we had just under 24 hours. So our task forces here in Minnesota, I got that from one of my drug intelligence partners out in Philadelphia, who developed the information that said, I have concrete information that there's 5 pounds of methamphetamine being shipped by UPS, and it's destined for this address. And so we had less than 24 hours, but with these task forces, they're able to work on those really quickly. So really, it does depend on the situation. Sometimes we may get a call from somebody in Phoenix, Arizona, that tells us that their friend is on the way up with a load of methamphetamine, and they give us a general idea of where they are, in which case we enlist the state patrol and the local task forces to look out for that car. But really, it's very situationally dependent. Sometimes we may have days, sometimes we may have hours to react to those.
So that just kind of like makes me think, you'd mentioned like this is just a small percentage of how much is there. I mean, I feel like you're getting a lot of information in a way. What percentage of what is seized, like what's the kind of consensus as what you think is actually out there? Like what percentage are you guys actually seeing of what's actually there?
Now, to be very generous, and working in drug interdiction for years, if we as in law enforcement nationwide were to seize 10%, that would be pretty good.
Wow.
It's that bad.
So John Pate had a little question, and it's kind of interesting because if you think about this, as you have these big seizures, there's clearly going to be some arrests.
Right.
Are these long drawn out processes, and do these people that are transporting this, do they see much prison time, or are you trying to always go upstream?
They can definitely see prison time, especially if we have somebody transported, particularly fentanyl or anything contaminated with fentanyl, synthetic opioids. They will be charged. And a lot of times when I showed you these bigger cases, we will enlist the help of our federal partners at the DEA, Homeland Security investigations, at which point the case can be what's called adopted federally. So it means the federal agency can adopt that case from the local agency. And now they're going to be looking at federal time and working with a federal prosecutor with that. So when we see these amounts coming through, these people are definitely having justice served because of the awareness of opioids and the amounts that they're transporting here.
Yeah. So I don't know if people have watched the documentary. It's not just a TV show. The documentary Trafficked on Netflix, the second episode is all about drug trafficking and coming from Mexico. And, they show them bringing stuff across and how they do it with ketchup and mustard and random stuff. But, they make the comment then with that is that, this poor single mom with all these kids is doing it because that's how she, gets money, but that new people are just going to step in place. So, I mean, what is kind of that long-term plan then? Because there's always going to be somebody else willing to carry the drugs.
It is very true. And it's something that, that law enforcement struggles with nationwide, whether it's federal, local, it doesn't matter. One of the things is, and it has nothing to do with politics, but the southwest border for years has been a major issue for law enforcement because of when you can smuggle 3,000 pounds across at one time, that creates a whole host of issues, not only for one city, but that is going to go to multiple cities throughout the country. So the southwest border, because of the land border, they can tunnel, they fly it over. They can ship it over on boats around San Diego to come in there to avoid the land border protections. So a lot of people are trying, but no one has really come up with a concrete solution as far as how can we, effectively shut this down while maintaining, the passage on the border that we need for everyday people. But you're absolutely right. In fact, there was a woman from Minnesota who went down around Christmas time to the Texas border and was stopped with 900 pounds of methamphetamine in Home Depot boxes wrapped up as Christmas presents coming back. So you're absolutely right. The profit margin is always going to draw people in. But as far as eliminating this completely, it's very difficult, and no one has a concrete solution for that yet.
Yeah. There was a question earlier about, and this has been something I think a lot of us have talked about because we have patients who are smoking marijuana and they have fentanyl in their urine. So address the whole, is there actually fentanyl in any of the marijuana that's coming across?
And then the follow-up was about loose tobacco even.
Yeah, or even a loose tobacco.
Okay, so, and this is a subject of great debate nationwide. And if you're in amongst different groups, there has been one confirmed case out of Connecticut where they determined that the marijuana was contaminated with fentanyl, intentionally contaminated. I'll leave it at that for now. And that was actually transferred to the Drug Enforcement Administration lab and was subsequently reconfirmed there that, yes, this was contaminated marijuana. A lot of the other cases that we're seeing across the country are probably due to lazy dealers, so to speak, because they may have envision a Tupperware container full of fentanyl. Okay, so they're going to make their pills and then sell those and move it on. Now they put a brick of marijuana in there. They're breaking it apart, breaking it down into smaller bags. It's going to pick up a little bit in there because they may not, adhere to the same standards as, say, a commercial drug lab. So a lot of that was related to incidental contamination, but it is out there. At what level is a big question we're all trying to stay in contact with. Across all 50 states with the U.S. Virgin Islands and Puerto Rico, we as drug intelligence officers and public health analysts are coming together to monitor that very closely. One very scary seizure recently had a spray bottle with liquid fentanyl, or fentanyl in solution would probably be a better term, along with a bulk quantity of marijuana. Now, that investigation is ongoing. Nothing concrete has been, and this was not in Minnesota, this was on a southern border region. The investigation's ongoing because they're trying to figure out, was the intent to contaminate this several hundred pounds of marijuana with this fentanyl in solution in a spray bottle. So that's something we're also watching very closely, but yeah, they're only limited by their imaginations at this point. But tobacco, I haven't heard of any contaminated tobacco, at least intentionally from a dealer perspective at this point yet, thankfully.
So when, we're talking about the UPS or speedy delivery and all that, obviously at the border, they have dogs smelling the cars and all of that. Do any of these shipping services have such things so that at least they have to be a little bit more careful in their packing?
And in some, I'm not aware that FedEx or UPS has their own. I am aware of relationships they have with either local police departments, sheriff's offices. State Patrol has been called to inspect a suspicious package at, whether it's Postal Service or UPS. But a lot of times what it does take is, for an attentive postal inspector to see something like that. Now, at the major hubs for the Postal Inspection Service, they do have their own postal investigation inspectors. They may have that stuff at their main hubs. I'm more speaking to here in Minnesota, where you think of your local post office or local distribution areas. So,
let's just switch gears for a moment to xylazine, because clearly there were actually on your little graph, there was actually 2 of our deaths had xylazine in it, which
in
little old Morrison County with 30,000 people.
Right.
I just had a patient who told me that his friend ordered a whole pound of it from China and it came through the mail. Is that illegal to possess xylazine in Minnesota?
So xylazine, listed as a veterinary drug, is it legal to possess? That's probably one thing that you could say no, because it's used as a drug precursor. Now, where is it scheduled on the federal drug statute? I mean, people can order, if it's limited to veterinary drug use by prescription, then no, they can't have that. But the problem is through China, literally you could order, we were seeing kilos of fentanyl being shipped. Highly illegal, obviously, but they would order it, say, off the dark web is typically where those purchases come from. But no, if you have that, it's a drug precursor.
Okay.
So with drug precursors,
it's a precursor to the effect that it's being used to adulterate fentanyl.
Right.
Okay.
So in terms of drug precursors, though, with the fentanyl coming from like the chemical versus like the poppy plant, and it was initially all coming from China, and then Mexico learned how to make their own precursor chemicals before they ship. Is there any like actual, United States producing a fentanyl, or is it just so much cheaper to come out of Mexico? Like why is our country just not making our own? That's, I guess, the question. Or is there?
And people do. Yes, we'll see through customs and border protection, different chemicals, the precursor chemicals coming from China. Thankfully, a lot of that, a number of years ago, when all the restrictions were put on shipments from China, we saw that go down substantially. But we do still see India and other places like that where it's not under so much scrutiny. But the reason it goes to Mexico is because Mexico already has labs super labs, they're called, used to produce methamphetamine. So using those labs to produce fentanyl is very easy. And the other benefit to China moving everything down there is because the cartels already have the established smuggling routes into the United States. So that whole program is set up. But what we're seeing coming into the U.S. mainly is if somebody wants to whip up a small batch, to put it lightly, basically. But so they'll put that in there.
There was a question earlier about, you showed us quite a few piles of drugs. And the question is, well, how do you guys dispose of all that? It'd have to be the biggest Tutera bag ever. How are you getting rid of all those drugs?
Well, we'll typically find nice companies who will let us use their industrial incinerators, because it has to be, it has to go to a certain temperature where it's not going to be released into the atmosphere. You can about imagine what would happen with that. So I don't want to speak to the particular companies right now because my information on those contracts is probably dated, so I don't want to misspeak on that. But typically you find one where there's industrial incinerators through large corporations who have those. An example, like 3M would be one. They would probably have something for that.
Okay.
Okay, so back to the whole, like the high risk, the HIDA counties we have in Minnesota, and you mentioned, Stearns is applying. Like, what constitutes, a high county, or how do you become? And then what is the benefit? Is that just because they're scrutinized more closely, or what is?
Yeah, so counties, when they're applying for that, they'll put in there, number of drugs seized in that particular area. They'll list overdoses. They'll list overdose statistical information to show that they are having a substantial drug problem. Also, the drug trafficking areas designation means that, it is a smaller, say, transshipment center. Like, drugs are not only going there as a destination, but then they're moving out from there. So as you see regionally throughout Minnesota, with Duluth being added, as we talked earlier, a lot of the opioids are coming from Chicago to not only the Twin Cities, but then the Duluth area. So then from the Duluth area, they'll move on out to smaller areas outside of Duluth. So that was designated as one, but a lot of times the qualifications are, how much is moving into and out of the area, and then how is it affecting, population, and overdose statistics certainly are an important factor there.
I have a question about the counterfeit pills in that, and we've had so many patients, and I'll give you an example. I had a guy who was buying Xanax from his friend. Okay. His friend was getting it from a doctor, and he truly believed that. And when we checked his urine, he had fentanyl in his urine, right? Mm-hmm. What percentage of the pills, have you guys done like controlled buys to know what percentage of the pills on the street actually have fentanyl in them?
Well, and we are doing some of that now. We started a MIN test program that was launched last year, which that particular program, we're partnering with several law enforcement agencies as a pilot project, and we just added Rochester PD, where they respond to an overdose. No one's going to be charged. It's a small amount of whatever they use to overdose, or there's a pipe, or whatever the case is. That we are partnering with Department of Public Health to send that to their lab so we can see exactly what's out there causing these overdoses, with the hope of scaling that up in the future so that at these overdose incidents. But the DEA estimates that about 40% of counterfeit pills contain fentanyl now. So, which is a staggering amount. When I said, people who are used to buying M30s are now surprised by fentanyl, it used to be something around 2 to 5%. Now they're estimating 4 out of 10 of those pills are contaminated.
Yeah, that's very interesting, because, it was even when fentanyl really first started to kind of make a showing in Minnesota, we were seeing it almost more in central Minnesota than the Twin Cities were. We have a pill press hanging out in Little Falls, apparently, in somebody's house that we know about. But as far as like the press, you mentioned Xanax. Is it pretty much just the Xanax that's mixed with, or is it any benzos?
Xanax is a popular one only because Xanax by itself is popular. So what they'll try and do is grab, the pills that are most popular in an area and then whip them up to look just like that, because they're already selling in a particular area. But another one nationally, which I just got an email on this morning, if you give me 1 second here, I can tell you which one has popped up on the national radar now. See if I can find this. Bromazolam is another one that is really starting to take off on a national level. So mixing with that. But typically what they'll do is they'll try and find something that's easily recognizable on the street, mimic that with a counterfeit pill because the profit margin's so high, and then push those pills out.
Sure.
So just to give us an idea, describe what your normal day, what do you normally do in a day, just as a description of what your job actually day to day looks like?
Sure. So right now I'm I'm entering the overdose data for the city of Minneapolis. They're shorthanded, they're short-staffed and very busy. So we are entering that information for them into ODMAP. So that's part of my day. Another part is, a big part of my job is the felony arrest notifications is the term for them. And as we discussed a little bit earlier, drug traffickers it's kind of like playing whack-a-mole. as you said, because as soon as you pull one off the street, somebody's going to fill that void. So part of my job is making sure across the country that we're keeping track of those Minnesotans who are arrested trafficking drugs in other states. So, for example, we have a Minnesota resident who goes to Phoenix, Arizona to pick up 30 pounds of meth. If they get stopped in Oklahoma, my counterpart, the drug intelligence officer in Oklahoma, will send me a notification saying this resident of your area was arrested with 30 pounds of methamphetamine. I, in turn, take that and send it to our contacts here in Minnesota so that the St. Cloud PD or the task force over that area knows that a resident in our area was arrested. So what that does is if someone's already on their radar for drug trafficking, this will help provide them more information to help shut them down. But if they're not on their radar, it gets them on the radar. And I've had a lot of those, especially in very small towns, where I said, we had no idea. For example, we had 30 pounds of methamphetamine going to Onamia. It's not very big, but 30 pounds of meth going there raised a lot of eyebrows because it was someone that was unknown to them and it was such a large quantity. So that's a big part of my job. And then working with Haley on the different initiatives that we have.
I guess I was going to ask one more question. Oh, yes. So as far as like learning, I mean, do you use a lot of CIs, and do you ever ask them, like, why are people mixing so much of this fentanyl in? I get that there's the better cost margin, but with the higher overdose deaths, I mean, they're kind of killing their own consumer, and how that process has evolved.
And that's true. And you can talk with them, and I think profit drives most of it. But I also think part of it is they cannot control the end users and how many they're actually taking, combined with the problem of when they whip this up when they mix these substances with the binders and such. As I said, they're not a commercial laboratory. They may, who knows, they may stir it up with a wooden spoon and call it good, 2 swipes. Well, now it's so lopsided on the amount of fentanyl in each pill. So they may be inadvertently killing people. So I think it's a combination of, I want to call it sloppy laboratory procedures, and the fact that they can't control the end user, because if the end user takes one and it has half the fentanyl the next one does, and they don't feel that high that they're normally used to, they may think, well, these are weak pills, and then they take 3 more. Well, those 3 might have 4 times the amount that they're supposed to have. And now, then we have the issues we've been having. As bad as one in city Minneapolis, Minneapolis police officer is providing CPR till EMS got there. And it wasn't until the eighth nasal dose of Narcan that the person actually snapped out of the overdose. Or it took 8 doses to reverse it, along with continuous CPR to get the respirations going. But that's the highest I've seen so far was 8 through the nose, which is a lot, which tells you the strength of some of these things that are out there.
Yeah, if anybody else has any questions, please feel free to unmute and ask.
Do you find a lot of magic bullets in the houses? I heard that a lot of people do like to mix all their drugs with magic bullets.
I don't know what that means.
The mixer.
Yeah, magic bullets that would be the more expensive one. So sometimes they'll go for, a little better quality, but it can be literally your $10, $15 Braun, coffee grinder. It's all over the board.
Wow. I have one last question, then we'll let you go. So sure. Everything's coming across from Mexico, or it seems like that has so much scrutiny. Do we ever look to our north? I mean, from the Canadians, some coming across at the Peace Gardens in North Dakota. I mean, who's going to suspect that, right?
Absolutely. We do. And we meet frequently with our Canadian partners. Frequently. Through HIDA has a program called Domestic Highway Enforcement. And we're always coordinating with our Canadian partners. It's not as prevalent, even though, you could put it in a small raft and ship it across and, push it across in some places or walk it across. There is definitely a tension there. It's just not as intense because of the amount that's coming through the southern border.
Yeah, I would think they would be trying to smuggle it in big groups of like hockey sticks. I mean, that's reasonable, right?
Well, exactly. And yeah, they'll smuggle it with anything. And I've heard our Canadian partners talk a lot about, the trucking industry. It can come up, into Canada a number of ways, whether it's by ship or however it is, and then they'll truck it into the United States. And you think, well, it's a Canadian truck driver coming into the United States. It's a company we recognize. You would think that, they can move some stuff through there, but there's definitely a tension up there. And CBP, Homeland Security definitely have good tools at the ports there.
Yeah, it's this was great. I appreciate this so much. It's just
maybe we'll think about getting you
crazy.
back 6 months from now and kind of hear what changes. And
Sure.
Something is really kind of changing in Minnesota around as far as the supplies. I think it'd be interesting to have you back every so often. So
yeah, it's interesting living on the Highway 10 corridor. There was a couple of days where I think I saw a dozen troopers every single day pulling over every semi truck that was going by, like literally every one of them for 2 straight days.
Mm-hmm. And there will be those times, based on some intelligence that they're going to be moving some drugs. They'll do that every so often. They don't unfortunately have the resources to do that full time. But our commercial, or the Minnesota State Patrol commercial vehicle enforcement, that's what they do full time. But as far as they do that all the time, but the troopers who are equipped with the canine or who work interdiction just don't have the resources to do it full time.
Perfect. All right. Well, thank you again, Ryan, for your time. We really appreciate it.